Hi there. I'm Tom Harrison. Welcome to this series of talks that I'll call Addiction 101 for Family Members. We're going to be talking about what addiction is, what goes on in the brain, why addicts behave the way they do, how family members react. We're going to talk about strategies to get your loved one, your family member, into treatment. We're going to talk about what treatment is and how it works, and what recovery is and how you can help your loved one through recovery and to prevent relapse. And we're going to talk about how to take care of yourself during the process. I'm the author of the book, The Complete Family Guide to Addiction. By way of background, I had a very close friend who developed a substance use disorder some years ago. And at the time, I thought there must be some book I can read, some resource I can find that would tell me how to help a person with an addiction. And I never found that. So after many years and a lot of research, I decided I should write the book. I'm a professional writer, and I worked with Dr. Hilary Connery, who's a Harvard professor and head of all the addiction programs at McLean Hospital, one of the country's top mental health institutions. So let's start by talking about what is addiction. What is this crazy condition that makes people behave in ways that are so self-destructive and other destructive, that they seem to have no control over, that they keep going even though they're losing their home and their family and their job and everything else in their life. What is this crazy thing called addiction? I think a good way to start is to talk about what addiction is not. Addiction is not a choice. It's not a decision. It's not something people elect to do. It simply isn't. No one says, I want to grow up to be an alcoholic. No one says, I want to lose everything that I care about in life and be enslaved to heroin. No one makes that choice. It's never a choice. However much an addict may seem to enjoy their substance, it's not enjoyment. It's just a relief of craving. It's not enjoyment. Another thing addiction is not is a weakness. It is not an inability to resist temptation. It is not a character fault. It's none of those things. So what is it? Addiction is a disease. Specifically, it's a disease of the brain. It's a brain disorder. In our bodies, if we have a problem with our lungs, the symptoms are going to be respiratory. If we have a problem with our heart, the symptoms are going to be circulatory. And if we have a problem with our brain, the symptoms are going to be behavioral, because the brain dictates behavior. Now, some brain disorders affect mood, such as depression or anxiety disorders. Some mental disorders affect perception and cognition, such as paranoia or schizophrenia. Addiction tends to affect the decision-making property of the brain in a very specific way. So addiction is a disease, but it is a very, very weird disease. It's the weirdest of all diseases. It's so strange. If you think about it, normally when you have a disease, you feel bad, you want to feel better, and you go to a doctor, and the problem is, how do you cure it? How do you make the problem go away, right? So if you have cancer, the doctor will say, well, maybe we should do chemo or surgery or radiation or whatever. Addiction is an upside down backwards disease, because typically the addict doesn't know or acknowledge that they have a problem. They don't seem to want to get better. And the puzzle is not how do you cure it, because literally a 7-year-old can figure out how to cure it. You just stop using the substance. It's very simple. The problem of the disease is, how do you get the person to want to stop? And that's a very different, strange configuration. It looks for all the world like addiction is a choice. It seems like people are just making a decision to use. It seems that way. And so addiction's been around for centuries, probably millennia, and it's always been treated like it's a choice. And one reason for that is that in ancient times, or hundreds of years ago, there weren't modern drugs like crystal meth or crack cocaine. Mostly what you had is alcohol. And the average age of onset for alcohol is about 17, 18 years old. That means that as soon as people reach the age of majority, as soon as they're an adult and can make decisions, that's when the disease sets in. If they're going to be an alcoholic, that's when it manifests. So it's not like people, lived for 50 years and were fine, upstanding members of the community and suddenly became an alcoholic. No, as soon as they became an adult, they started exhibiting these symptoms. So people said, oh, that's just who they are. That's how they choose to be. And that makes sense, although it's wrong. Things started to change in America in the late 19th century when there was a new wonder drug that came on the market. It appeared to cure everything, and it was prescribed like candy. And after people started using this drug, you had people in middle age or older, upstanding members of the community, bankers, ministers, society matrons, who all of a sudden started exhibiting the crazy symptoms of addiction. And that's when people started to think, maybe the problem is with the drug. Maybe addiction is not people behaving badly with regard to substances, it's substances behaving badly with regard to people. These substances are themselves addictive. And by the way, that wonder drug was morphine. So people forget there was an opioid crisis in America back in the 19th century. So people thought maybe these substances are addictive, but so little was understood about the brain, nobody really knew what to do with that. In the 1930s and 40s, Alcoholics Anonymous came along, and Alcoholics Anonymous said, we think there's a way to treat addiction. And then it seemed even more like a disease because you could treat it. So in the 1950s, the American Medical Association said, you know what? We think addiction's a disease. We don't really understand it, but we think it's a disease. And since then, that's been 70 years, generations have said addiction is a disease. They mouth that, they pay lip service to that idea, but nobody really understood it, so nobody really acted like that was the case. We say it, but we don't mean it. I was at a meeting once of family members, and a guy said, my brother is an alcoholic, and I know it's a disease, but I'm really mad at him for having it. And I think that says it all. No one is mad at their brother for having leukemia, right? It's a disease you get mad about because really deep down you think it's a choice. And this went on until about maybe 20 years ago when, for the first time, scientists had MRIs and CAT scans that were available and affordable for research. And then they started analyzing what actually happened inside addicts' brains, and they started realizing there's a very specific process inside the brain. And so for the first time, we could say, okay, we just don't think it's a disease. We can see it. We understand the process that goes on inside the brain. And now we know it's a disease, and we understand the process. So I'm going to wrap up here. In part 2, I'm going to walk you through that process, and you'll understand exactly what's happening in the brain of a person who has an addiction. Thanks so much.